3 things you need to understand about using painkillers as a hangover cure. Contrary to popular belief, painkillers cannot cure hangovers. Typically, one might take any one of a number of painkillers to relieve the after effects of last night's boozing, but unknown to most, there are some risks. Though you might feel a little better from your headache and muscle pains, here are some reasons why a pain reliever will not do the whole job of curing a hangover. Point number 1, painkillers cannot take your entire hangover away. A hangover is not simply a headache that you get after drinking alcohol. A hangover is severe discomfort characterized by consumption of alcoholic beverages. Common hangover symptoms are headache, gastrointestinal distress, nausea or vomiting, dehydration, exhaustion, dizziness, and mental confusion. Alcohol intake may have different effects on every individual. According to studies, alcohol has different effects on men and women. An average woman has less water in her body than the average man does. And since alcohol spreads in body water, a woman's blood alcohol level will be higher than the man's when both consume the same amount of alcohol. Thus, the hangover will affect a woman quicker and will last longer. So, pain relievers can relieve you from your body aches and pains, but that would be about all. Point number 2. Some pain relievers can have bad effects on your liver. Acetaminophen, commonly known as Tylenol, is analgesic and antipyretic. That is to say, the drug can be a relief for headache and reduced fever. But then, before you pop the pill for your hangover headache, be aware that chronic intake of acetaminophen added with constant alcohol consumption can be linked to various liver diseases. Number 3, pain relievers can complicate gastrointestinal distress if you have stomach systems. Aspirin and ibuprofen can actually make you feel worse when you are suffering from abdominal pain, nausea, or vomiting due to a hangover. Alcohol itself is a gastric irritant, and so are nonsteroidal anti-inflammatory drugs, NSAIDs, like ibuprofen, aspirin, and naproxen. Common side effects of NSAIDs are gastrointestinal ulcers and stomach bleeding when taken at higher doses. Therefore, taking NSAIDs may help your headache, but you run the risk of irritating your stomach more. To sum this up, unfortunately no one has found a perfect cure for hangovers in the form of a morning after pill. Over-the-counter pain relievers may help some symptoms, but they offer an incomplete solution and in some instances may cause additional problems for your stomach liver. Promising solutions are available by supplement makers for taking over-the-counter tablets that you take before drinking alcohol and seem to offer the best hope for solving the hangover complexities. Dr. P's HG3, Hangover Prevention in a Chewable Tablet, formulated by a practicing medical doctor in the U.S. and based upon real research, real science. Dr. P's HG3, whenever not getting a hangover, is worth $5. For more information or to purchase HG3, please click on the link on your right. We would appreciate you liking us on Facebook and subscribing to this channel.